Hello, I'm Angela Stepp, Director of Communications for WSOT TV and Sunnycrest Baptist Church. In a moment, Grant County leadership will be sharing with us a community update with information pertaining to the current COVID-19 outbreak. This community update will be rebroadcast today at 5:30 p.m. and 10:30 p.m. here on WSOT TV, and again on Sunday, March the 29th at 10 a.m. and 5:30 p.m. It will also be made available for distribution online and through various local media outlets. You can help our community stay informed by sharing this important information with your family and friends. Now, joining us today will be Bob Jackson, Grant County EMA Director, and Grant County Commissioner Barnsley. And we will also be hearing from Chief Angela Haley of the Marion Police Department, Dr. Brad Lindsay, Superintendent of Marion Community Schools, Marion General Hospital Representatives Sarah Evans and Dr. Dean Ricks, as well as Dr. David Moore from the Grant County Health Department and Amber Turner, Public Health Nurse. Now, up first, you will be hearing from Mr. Bob Jackson of the Grant County EMA. And I welcome you to the platform.
Thank you and good afternoon. My name is Bob Jackson. I'm the Grant County Emergency Management Director. We just want to give you an update as to where we are in our current stage of things, our planning that has taken place, and really who's been involved. There's a lot of people behind the scenes, so we would like to just let you know who is actually helping us get through everything that's going on. The first thing I want to touch on, and I know you'll hear it a lot today, we'll repeat it a lot, but it's honestly the biggest thing we have going for us is the better efforts that we employ and use now for social distancing. The better we are at that, the sooner we will get through all of this, honestly. We have statistics that prove that over and over again across the world. We have seen this work, so we really have to step up and do the best we can there. Now is truly the time for action. We have been planning for weeks. The health department, EMAs across the state of Indiana, we have been meeting for literally a month and a half now, 6 weeks. We have been meeting, planning, trying to predict what's going to happen next so that we can plan for that. And so here locally, how that has worked is through the Grant County Emergency Operations Center, which is located in my office. We meet every day for a daily briefing. We do a threat assessment. We're advised from the state as to what's coming at us. They have their best folks feeding us information so that we can make our best decisions that we can from the information that we have. In those meetings, the Grant County Health Department has been the lead agency through all of this, and they'll continue to be. It's a public health emergency. They're the people that take care of that for us, and we get our guidance and leadership from them. Also involved in that is Marion General Hospital and Grant County EMS. Those are truly the lead agencies that are looking out and planning for and taking care of our healthcare workers, all of our healthcare workers. This doesn't mean just Marion General Hospital. Our long-term care facilities, a lot of other facilities in the county that are working with people. They're going to their homes. There's a lot of things that happen, and all of those people fall under the umbrella of healthcare worker. That has truly been our focus, is to protect all that goes on. So back to the social distancing for just a second. And with all that I just said, honestly, it is now, it's truly now that we need to do everything we can. That's our main focus, is to protect the healthcare system, and we truly have to be on it. Some other organizations that meet daily in the EOC, law enforcement and fire, literally all of the law enforcement agencies, including the Indiana State Police and every single fire department in this county, are prepared. We've planned, we've trained, we've done everything we can to be ready, and they're fully ready and prepared to go for whatever the next 14 days brings us. We know that we're in a 14-day window where we've been told to expect a peak. That's what we've been telling people for a long time, that we want to flatten that curve. We're there. We are entering that window at this time. So all of our agencies have been planning for this. and doing the best we can to be prepared for it. Been many public and private organizations working together. Food is available. There's no need to be concerned about that. The food supply, the chain has been protected. The governor is still allowing all those shipments to happen, so it's coming into the county. Our grocers are doing a wonderful job. We can't thank them enough for keeping everything available to us. So there again, no need for panic at all in that. Volunteer organizations, schools, churches, they've all stepped up to fill the gap where, and sometimes they fill a gap that we're not even aware happened. So they're truly out there doing a wonderful job for us, and we appreciate it. Lastly, I just want to stress that PPE, personal protective equipment for our healthcare workers, is our biggest concern at the moment. And what you can do as the public to help us with that. Honestly, the social distancing works, and it works because if you don't get sick, we don't have to come in and provide service to you, because every patient that we contact uses PPE. 30 years as a firefighter, I equate it to firefighting. If your house don't catch fire, I don't have to come in and get you. This is the same thing. If you don't get sick, we don't have to treat you. And really, it's a win-win. You stayed well. We didn't have to treat you. So that takes a big burden off of our healthcare workers that are already being pushed pretty hard, and that's not going to let up anytime soon. So if we can maintain those efforts, that's a big deal. Delaying minor medical procedures, doctor's appointments. In fact, my doctor called me yesterday. I did it over the phone. So there are other ways to do these things. Teeth cleanings, those kind of things, we can delay those and put them off. That truly helps. The last thing is, honestly, I know it sounds simple. I don't want to underline this too much, but really stay home, stay safe. We know there's things you're allowed to do, you can do. We've got rights to do some kind of things, but honestly, stay home and stay safe is the biggest deal you can do for us. I appreciate the time here at the church. Sunnycrest has been great helping us get this out, and really all of our media partners doing a super job for us, and we appreciate it. With that, I'll let Commissioner Barnsley step up.
Thank you. And next we will hear from Grant County Commissioner Mark Barnsley.
Thank you, Angela. Good afternoon, and since Governor Holcomb's most recent executive order, the stay-at-home order that happened on Monday and was put into effect last evening, I've thought of many different things that we needed to share with you as a community. And first, let me say thank you for your dedication and active participation in doing this social distancing, as well as staying at home, staying out of contact with a lot of the public. I can tell you firsthand that as I was driving here today, I was listening to a press conference with Governor Cuomo of New York, and he was saying that social distancing is working for them, that they are seeing a spread in the demand of what Bob talked about in medical services, and so it is working in New York, what is probably our epicenter right now of what's going on with this coronavirus. So please continue to do that. On March 19th, we went on to a orange level travel warning. We already had implemented that, and the state has just implemented basically what we are doing or have been doing for the last week. And so we've already been practicing that for the last week, making sure we stay at home, going just to those essential services we need. If we need to go to the store, if we need to go to the doctor, there are other things that are available, and there will be websites that I believe will be put on the television here for us so that we can see exactly that information we need to know. Make sure that you get that and take a look at it. In keeping with what we've been doing, Grant County government is still functioning, it's still working. Our first responders, police, fire, EMS, they are all working on your behalf. What we're doing is continuing to push forward with these infrastructure needs, the things that are going on, so that when we do get back to our normal lifestyle, we will already be moving right along. And so again, your participation in these activities really help us to make sure that Grant County moves forward. As I was driving here, I also noticed many of our drive-thrus are open. Carryouts are available. And I know some people that have already said that they would be willing once a day to make sure that they continue to help our local businesses as they do a drive-thru, get something to eat, and then go right back home and be safe and secure. One other thing I'd like to mention as we conclude, I've noticed a lot on social media that people have been expressing their concerns, their fears, the uncertainty of the days that we are going through. Now, many of you know that I'm not only a Grant County Commissioner, but I'm also a chaplain with the Marion Police Department. And I would say to you that our reliance on God in times like these are most beneficial. We need God in times like these. And I take courage myself in the words that Jesus said in John chapter 14. He said, "Peace I leave with you. My peace I give to you, not as the world gives. Do not let your hearts be troubled. Don't let them be afraid." As we're going through this time, we need to make sure, whatever circumstance we're going through, that we can trust in someone who's greater than we are, the one that loves us, the one that gives us hope. So I can say without hesitation or reservation, our people, the government, the first responders are doing everything that they can do to help us through this crisis. And with God's help and your continued support, we will get through this. Thank you very much.
Thank you, Commissioner Barnsley. And as I invite Chief Angela Haley of the Marion Police Department to join us, I will also reiterate what Commissioner Barnsley just said. We will be communicating through a lower third scrolling message on WSOT TV throughout the coming days, information which pertains to contact information, phone numbers, websites, et cetera, for various county organizations that you can contact for assistance. So at this time, I'm going to invite Chief Haley to speak.
Thank you. There have been many rumors circulating. As of March 25th, 2020, Grant County is still under the orange travel advisory because of the COVID-19 pandemic. This travel advisory is supported by the City of Marion and has been in effect since March 19th. The governor's order, which went into effect at midnight, moves the entire state up to what we were already doing in Grant County last week. The stay-at-home order from the governor included a travel ban. The exceptions to the travel ban are for essential activities, essential government functions, essential business and operations, or minimum basic operations. You are permitted to travel to care for the elderly, minors, dependents, persons with disabilities, or other vulnerable persons. You may travel to and from work. You may travel to the store, and you're allowed to visit restaurants or bars in order to get carry-out or to go through drive-thrus, and those businesses are allowed to continue with delivery services. The Marion Police Department is not pulling people over simply because they are out. We are continuing normal operations. The governor's order does not provide blanket coverage for citizens to commit traffic infractions or criminal offenses. Enforcement activities are continuing. There are going to be a few exceptions. We've been advised by the state not to take enforcement action on state statutes or laws related to the expiration of credentials, which would include your driver's license, driving permits, and vehicle registrations issued by the state of Indiana, which may have expired during or are set to expire during this public health emergency. In addition to that, the expiration of any license to carry a handgun issued by the state of Indiana, which has expired or is set to expire during this public health emergency, is extended to March 22nd of 2020, and no enforcement action will be taken solely based on the permit's expiration. When citizens are calling into the dispatch centers located in Marion and Grant County, I'm asking for you to be patient as the dispatchers ask for information. At our dispatch center and every other dispatch center in Grant County, callers requesting assistance from police, fire, or EMS are being screened. In addition to the questions that we would normally ask related to what the call or emergency is in reference to, we are asking If anyone in the house has been experiencing any of the following symptoms: fever, cough, shortness of breath. We're also asking if you have traveled outside of the country in the past 21 days or if you have had contact with anybody who has been diagnosed with the COVID virus. These questions have been added and are being asked to help protect first responders. We're all in this together, and I'm imploring you to follow the recommendations of the CDC and your local and federal and state elected officials. If you don't need to go out, don't. The best way to prevent the illness is to avoid being exposed at all. If you need to go out, keep your distance from others, and the recommended distance is again 6 feet. Please wash your hands frequently with soap and water for at least 20 seconds, and avoid touching your eyes, nose, and mouth with unwashed hands. We're also asking that you avoid close contact with anyone who is sick. For reliable sources of information during this health crisis, please refer to credible sources of information. Some of those sources include the Centers for Disease Control and Prevention, the Indiana Department of Health, and the Grant County Health Department, and of course, Marion General Hospital. And on a personal note, when we're under stress, a good thing to help alleviate that stress is to focus on the needs of others. And we've got many, many people in this community who are dependent on public transportation, elderly, disabled people. We also have people in the community who have been impacted by addictions, and those meetings are no longer being held where they can meet together. They're being checked on remotely, telephone, that type of stuff. If you know someone, family member, a relative, a neighbor, who needs something from the store or just needs a few words of encouragement, please reach out to those people. Again, we're all in this together. We're going to make it through this. This is a moment in time that is unique. We've never experienced anything like this before. So if you focus on the needs of others, that's going to help alleviate your stress, and it's going to make the community stronger in the end. I thank you.
Thank you, Chief Haley. And next we will be hearing from Dr. Brad Lindsay, Superintendent of Marion Community Schools.
Thank you, Angela. We love you. We love Jason as well. And Sunnycrest Baptist, you are a fantastic church community. And giving us this opportunity in this time of need, we just want to thank you. We live in a great community. We've got great people. And I want to thank our community for encouraging and loving one another. Thank you, community, for exercising wisdom, for being respectful, responsible, and safe. We are in God's good hands, and we need each other. And together, we're going to fight and get to the other side stronger, more united, and better. I want to encourage our students and families. We love you. School is closed for all county schools, governor's order through May 1st. Please stay connected with your schools during this time. Our principals and teachers are offering optional enrichment activities that students and families can choose to use to keep the learning growing. Please reach out to your child's principals, teachers, and social workers so we can best support your family while school is closed. Email addresses are available on our websites, and all Grant County schools were in this together. All Grant County schools, we love our children and our families. We're in this together. At Marion Community Schools, we're having food distribution today. Today is our second week. It is set for 4:00 p.m. today at Justice Intermediate School. Please note, with the great help from Chief Haley and our local police, with Bob Jackson and Grant County EMA, and with our public health, we have a different traffic pattern, and it's changed from the first time. You should approach coming west on Kim Road. You'll begin at the first Kendall Elementary entrance and be directed from there. A map and more information is available on our Marion Community Schools website. Food will be available for all who have school-aged children and teens at home in Marion as supplies last. Last week, we passed out over 30,000 meals. We're prepared to pass out over 40,000 meals today. We appreciate your patience, being respectful, being responsible, being safe, as we put this new plan in place and work to find the best way forward in this unprecedented situation. All Grant County schools are offering food distribution during school closure through May 1. Information can be found by contacting your school's website your child attends. Thank you to all for encouraging and loving one another. Thank you for exercising wisdom and being responsible and safe. For those who continue to work on the front lines in so many ways to meet the needs of our community in this difficult time, we have extreme respect and gratitude for you. You've risen to your best where your best is needed, and we're so thankful. We live in an awesome, caring, generous community. Thank you, EMA. All of our health workers, police, fire, and emergency responders, you're our heroes. You're laying on the line 24/7 for us. Thank you for being there for us. To our students and families, we love you. We look forward to when school can reopen so we can connect again face to face. Continue to stay connected with us. Continue to be respectful, be responsible, and to be safe. Thank you, Angela.
Thank you, Dr. Lindsay. And next, we are going to hear from Marion General Hospital Representatives Sarah Evans and Dr. Dean Ricks, and I'm going to invite them to speak now.
Thank you. We're happy to be here again with you today just for some updates as to things that we're doing at the hospital as we prepare. And so there was communication that went out this week with some limited restrictions to availability of services for outpatient laboratory services and for outpatient radiology services as we try to reduce the number of individuals coming into those facilities. So there are still services available for laboratory services Monday through Friday at our outpatient building locations located at the 330 building, which is on 330 North Wabash, across from the hospital, and also our Northwood location and our South Marion Medical Park location. We are also asking that all potentially outpatient radiology tests that can be performed at our South Marion Medical Park, that those individuals present there for those through our scheduled appointment times. And also just to assure the community that at all of our primary locations, we are creating screenings that have been going on in place for over a week now at all of our primary locations where we are asking screening questions, and we have extended that to include taking the temperature of those people presenting to those locations. So please understand that process to keep our community, our patients, and our healthcare workers as safe as possible. We do want to remind the community, if you are experiencing symptoms and that you think you might need to be treated or seen or tested for this virus, that you call our call center number first. That number is 765-660-6999. And again, that is our call center number for anyone who is experiencing symptoms or has concerns related to this illness. We want to thank the community for those that participated in the blood drive last week. We were able to receive 48 units of blood, and that is critical at times like this. We are continuing to work to organize another community event for blood donation drive, so please look for information for that in the coming days. And I just want to take a moment and thank our community members, our local churches, businesses that have been supporting us in the healthcare field throughout this. We have received numerous donations of tokens of appreciation for what we're doing. It has been really encouraging to our staff, and we appreciate that and just want to take a moment to say thank you. I'm going to hand it over to Dr. Dean Ricks with some updates about the virus itself.
And first of all, I'd like to say we have to remember not to panic and not to fear. Again, the coronavirus is an upper respiratory tract virus, which in the vast majority of the people produces mild to moderate symptomatology like cough and a runny nose, fever. And so it's important to remember that. And now the signs and symptoms to look for are high fever, cough, and shortness of breath. And other symptoms, as the virus has been around now for a while, we've seen other symptoms emerge, including sore throat, runny nose, and nausea and vomiting. And despite the fact that for most people the virus won't be life-threatening, it is in some people, and those being the elderly and those with chronic lung, renal, and heart conditions. So it's important to remember that although we may not be affected as severely as they, we need to look out for those who are most vulnerable by keeping our social distancing and remembering to isolate ourselves when we're sick. And we'll get through this together.
Thank you.
Thank you both. I appreciate it so much. And next we will hear from Dr. Moore from the Grant County Health Department, as well as Amber Turner, public health nurse. I'm going to invite both of you to come and join us at this time.
Thank you. Good afternoon. Thank you for having us again today to give you guys an update. Grant County has 3 confirmed COVID-19 cases. The health department wants to encourage everybody to stay home if you're sick, wash your hands frequently, cover your hands or cover your cough and your sneezes, but also remember your social distancing at least 6 feet apart if you are out, if you need to go to the grocery store or get gas or other essential needs. We also would like to let the public know, just because we kind of want to keep those rumors down, that if you have been in close contact with one of our lab confirmed cases, you will be notified by the local health department and of your possible exposure. There is criteria that the Indiana State Department of Health and the CDC has given us as far as what is considered a close contact. So again, we would like to let you know that we will be in contact if you are at possible risk. We want to settle the fear and the panic in the community of people just for symptoms that they're having and people thinking the next person next to them has coronavirus and they're not aware, but we will be in contact with you if we do get a lab confirmed case. Also, we're receiving a lot of phone calls with what the governor has put out with the stay-at-home rule as far as what is essential, and employees that think that their employers, that they should not be open. We encourage you to speak with your employer, and there is a hotline, we can put that on our website, that the employer can call if they are concerned if it is an essential need. But also remember that the governor doesn't want people to not have their job. He still wants people to be able to go to work and get a paycheck. So the employers, they have to follow their guidelines too, and just because they are open, they might be an essential need for another company that they are a supplier for. So we just want to encourage you to speak with your employer before you're on social media and saying negative things about your place of employment. So I encourage you to talk to your employer. We're more than happy to direct people to answer their questions or anything else that they need, but with those work-related, we ask that you speak to your employer. Also, one other thing, the Dean from our foods, he's kind of overseeing the PPE that's being distributed to our first responders and long and short-term care facilities, that if you have items that you can donate as far as masks, gowns, or gloves, that you would email him at foods@grantcounty.net if you have some donations, and then he will be answering those emails. Also, on a personal note, I would like to encourage everybody that there's a lot of people around that are in panic and have anxiety and don't seem to have hope, but this is a time that we are to lean on each other, and it is the unknown that people are fearful of, but we do have an amazing God that is in control in the situation. So this is a time to encourage and uplift each other, because this will pass, but we are all in this together to make it through. Thanks.
Thank you. I want to thank Sunnycrest for, again, opening up your doors to the community. As we're listening to this, some things that impressed me. Number one, there's a virus that sprung out of nowhere and has swept across not just China and Asia, but across the world, and has changed our lives. What also impressed me is how the medical community has stepped up to try to understand and wrap their arms around them, and that in the nation, in the state, but particularly in Grant County, of the healthcare and first responders and people who are responsible for looking after the safety of Grant County have come together with a plan and worked to make sure that our community, that they, one, know what's going on, two, that our community is prepared to deal with this. And I've been just amazingly impressed with what has happened. And the last thing is that the kindness that this has brought out of how we as a community have come together to respond to this. And one thing in particular that excites me, along with all of the volunteers that have been there, is our fabric store, Joann Fabric, has come up, and we've talked a lot about personal protective equipment and how important that is. This virus is spread by droplets, and to the degree now, while those all except the most expensive masks don't filter out the virus, if we can reduce the droplet spread that come to one another, then we can. So our medical personnel need the top quality things when they're dealing face-to-face with heavy viral loads. But at nursing homes and at other care facilities, what they need is just something to help to reduce that spread. And we add that margin of safety, and just impressed at how our community has responded to that, but particularly how Joann Fabric has. And what they have, that material that they have that might otherwise go to other uses, they've made, not just here, but all over, available. They have a kit and they have instructions on how to do it. And you can either drop the finished product off at Joann Fabric in a bin that they have, or to the front desk at Marion General Hospital, where they'll make sure that it gets into the hands of donors, and where we can go and reduce that risk there. It impresses me that we as a community have faced this down. We will get through it. Amber has said that with faith in God and with working together, we're going to get through this. It's going to be rough. We're going to have a hard time. But what has impressed me and what I'm very pleased about is how our community has come together to be one community, to taking care of one another. It makes me proud to be here in Grant County. And again, Sunnycrest, and for all of those who've worked so hard for this crisis, thank you very much.
Thank you both so much, and thank you to Joann Fabrics for providing a means for us to be able to help in this difficult time. Now, as we conclude today's community update, I want to remind you that it will be rebroadcast today, March the 25th, 2020, at 5:30 p.m. and at 10:30 p.m. here on WSOT TV, and additionally on Sunday, March the 29th at 10 a.m. and 5:30 p.m. I would like to thank our local media for their collaboration and their outstanding efforts to cover this event and keep our community connected. We need you now more than ever. Also, thank you to Mr. Steve Wright of Wright Promotions for his assistance with this effort, and also thank you for watching. We now return to our regularly scheduled programming.